Pathway to Excellence is an American programme that helps leaders to create the very best practice environments for nurses, midwives, AHPs and other clinical colleagues to practice in so that patients ultimately get the very best care. We'll be doing this across all of our sites, so across Newark, Kingsmill and Mansfield Community Hospital, and we'll be learning from colleagues at Nottingham University Hospitals who were designated last year.
Staff wellbeing and resilience are essential components in the strategic planning efforts of Pathway to Excellence organisations. Staff are active participants in the selection, planning and evaluation of wellbeing initiatives, as well as creating schedules that promote a balance between work and personal life. Nurse leaders foster a culture of day-to-day recognition, and nurses are acknowledged for community volunteer activities. Pathway organisations foster resilience through support processes that address both physical and compassion fatigue, as well as focus on staff wellbeing following adverse situations. The organisation assesses the health of its employees and implements appropriate health initiatives based on the results of those assessments. The organisational benefits can be seen through higher staff retention rates and a more involved, motivated and confident staff.
We've got a saying, and I think it comes from the Chief Operating Officer, that we look after the people who look after the people. And for me, that's all about well-being. And well-being is about not just looking after our staff, making sure that they feel happy in their roles and they've got what they need to do their roles, but looking after their mental and physical health as much as we can and supporting that. It's also about making sure that people have a flexible working life if they want that, to have that work-life balance. So looking at sort of HR practices to support flexible working and things like the carer's passport. So if you're caring for somebody, so it's all about that sort of flexibility and sort of making sure that, you know, we sort of look after people to do their roles. And lastly, it is about sort of recognising all the fantastic work that people do when they sort of step up and above their roles. So from our nursing, midwifery and HP examples, you know, we've got lots of examples on a daily basis of people doing fantastic things, and we just need to, that's part of the wellbeing offer and sort of, you know, the thing that we work towards is making sure that people are recognised for that, because that all builds into people's wellbeing. If people are happy, then they give happy care to our patients. I can think of a few examples where we can see where the voices of nurses, AHPs and midwives have been pulled straight through into our wellbeing offers and the strategy that we've been developing. So the first of these would be around how people respond to incidents across the hospital that does cause them psychological harm. We're in a hospital, these things happen, whether it's patient-facing or the relatives that sort of attend or visitors to the hospital. And we have listened to a lot of our staff who have been involved in incidents and feel that they haven't had the sort of the proper support from the organisation in terms of their well-being and their sort of psychological harm. And that could be even things like physical abuse or verbal abuse from people. And people take that home and dwell on it. And from talking to and people raising those concerns from the at ward level, we've now we've got a welfare and wellbeing lead that's substantive and in place. And we've got a clinical psychologist that we've employed as an organisation. And we're looking at the whole team debrief process and individual debrief process. So we can make sure that people are aware of what support is available to them and that they can access it. And there's no barriers to that. You don't have to meet a criteria. And I think that's a really important step forward as an offer to our staff. And that's come directly from feedback from our nurses and our clinical staff. And our HPs and midwives as well. So and all the other staff that sort of encounter that sort of that harm sometimes just when they're doing their normal roles. I think that AHPs, nurses and midwives are our largest percentage of staff or colleagues across the hospital. They must be over half. of the total number, and they've got such a lot of power then to be able to sort of highlight to us and to their ward leaders and to other colleagues through the Pathway to Excellence process, the shared governance process, if they're struggling or if they've got ideas. So I think that, we'd ask them to do as they're doing now, which is to share their experiences and be confident that we will act on them, and that, that sort of thread from patient-facing services and that front line right through to the executive directors, that gets followed through and it is shared and it will result in action. So speak up.